with open arms. We know the times get hard, and we're here to help at NorthPoint.
All right, hello. Welcome to Making Health Happen, listeners. Today, I'm so excited. We are going to be talking about a topic that is near and dear to my heart, which is Black maternal health. And joining me today is our very own Dr. Lavonne Moore. Dr. Lavonne Moore has a doctorate in nursing practice, is a certified nurse, midwife, and women's healthcare nurse practitioner, and board-certified lactation consultant. Dr. Moore practices here at NorthPoint Health and Wellness and is CEO and founder of Chosen Vessels Midwifery Services and the Chocolate Milk Club, CMC, a culturally specific service of Chosen Vessels Midwifery Services, CVMS, that provides breastfeeding education and support for African American women. Welcome, Dr. Moore. Thank you for being on the program today.
Well, thank you for having me.
Yes.
Thank you for having me. It's such an important topic.
It is a very important topic. This is something that impacts our Black and brown community, our women of color, and just so happy to have you here on the show today. So before we dive into it, did I say midwifery right?
Yes, you did. Okay. A lot of times people say midwifery, but it's actually midwifery. We're midwives, but when it's midwifery when it's to speak in plural.
Okay, midwifery.
Yes,
midwifery.
Yes.
All right, great. You heard that, listeners. Midwifery, not midwifery. Okay, Dr. Moore, tell us, what are some of the factors that are contributing to disproportionately high rates of maternal mortality amongst Black women in comparison to other racial and ethnic groups?
Well, one of the things that I hear Black women talk about specifically is about not being heard. When they're having issues, that they're not being listened to or heard or addressed. And so there's some concerns that when they're saying my body doesn't feel right or something's wrong, that no one is listening. We know that socioeconomic disparities, racism, especially around the construct of racism in healthcare, the way it's set up, contributes as well. We're lucky in Minnesota. I can't always say what's happening nationally. I think nationally you have issues of health care insurance and access and some of the things that honestly are not barriers in our state. Our conversation's a little different because there's a lot of access, right? There's a lot of services and support, but yet our numbers are not any better. And so that is alarming.
Okay. Would you be able to share, I mean, you don't have to give me exacts, but when you talk about the numbers, can you speak to that a little bit? What kind of percentages are we talking about?
Well, our infants die 2 times or more than other infants of non-color. So we have a high disproportionate infant mortality rate than other communities. We also have a high amount of maternal morbidity that's related to multifactorial, of course. These are complicated multifactorial issues, but we notice that we're having more and more problems in the postpartum period, right? With postpartum hypertension, many more women, and that was something that was not as it is becoming more common, are having complications or having postpartum hypertension, and they're dying more in the postpartum period in those first couple weeks after birth than we've heard of in the past.
Okay, so these are conditions that, are they pre-existing? Are women aware of these things in their pregnancy or is this something that's an onset after childbirth?
Well, there's a little bit of both, I think. Some of these things, I think science has yet to catch up with in terms of what are we looking at. I think what we're seeing is some of a fallout, for lack of better words, of our general food practices in this country. I think nutrition has an important part to play in a lot of things, as it's so important to good maternal health. Processed foods, fast foods, those things have lots of salt, lots of fat that can contribute to poor health outcomes, and it has, right? For our general public in America, right? We have this epidemic of diabetes and obesity. And then when you look at certain cultural groups, especially African Americans, who bodies or systems are more sensitive to high sodium and those kinds of things that we know is a major preservative, right, for processed foods, it can contribute to changes that impact blood pressure or other issues. So I think the way we eat in this country impacts all people, and it certainly has had a negative impact on African American women. What food you have access to, right? We have food deserts, right? Absolutely. So you don't have access always to fresh foods. We have a lot of access to fast foods, and those things impact our health. And I think that's one of the reasons why NorthPoint has took on, their Fresh Fridays, right? Because it's important to make sure that people have access to fresh foods and vegetables. And people often say, well, why does that make a difference? Well, it depends on your approach. And I always explain that I have a holistic approach to healthcare. So when I look at the impact of health, good health happens at home, right? Right. Really doesn't happen in the doctor's office, right? I think that's a misnomer that people are really kind of confused about, is that, good health happens at home. And we have this healthcare system, this name healthcare system. And really, to be honest, are we a healthcare system or are we a diagnosis and treatment system? Okay, we treat illness. And so, but gratefully here at NorthPoint, we have a lot of resources that allow us to look at the wholeness and health of individuals, and that's the approach we're attempting to take. So Fresh Fridays, where you can get fresh produce, like today here at NorthPoint in the parking lot. That is important to improving the health of the community because we're live beings, and live beings need fresh food. We need live food to keep our cells healthy and help to prevent disease. So food deserts, I think, is a piece of that. Also, this increase, some of the things that impact everyone, right? This increased in homelessness, right? Not having stable housing can impact one's pregnancy, right? Where you live, slum landlords, not having places that have the right, that are unhealthy in general, that is may have rodents in it and things that can cause health challenges. So I think where people have access to care, the kind of care that they're getting, their housing, their employment, all those things that are considered part of those whole social disparities.
Those are those socioeconomic factors, those disparities that we're talking about.
All of those impact our health outcomes. Support systems, right? So where you live, who you live with, what you have access to in terms of food, your economic status, all that impacts your pregnancy.
Absolutely. Wow. Well, let's talk about racism. Okay. And let's talk about how that plays a role, systemic racism within the healthcare system, that really exacerbates these things that we see in maternal health outcomes for Black women.
Well, first, I just want to talk a little bit about that word you use, systemic, because I don't know if people understand. That means those are systems, right? Our system of healthcare, our system of banking, our system of real estate, our systems in this country are based on racism. And until we be honest about that and acknowledge that, we can't improve upon those, right? It's like you can't change it if you can't name it, right? And so these systems, look at our correctional system. These are systems that are systemically were put together by the founding fathers of this country to enrich one population and oppress another. So that's what you mean by systems. Yes. And so I think that's why it's important for us to understand our history and where we come from in order to truly understand what's happening in this country. And so these systems have created barriers that contribute to poor health outcomes. And one of those is that we find even in the patients that we serve, our guests that we serve here, is that because our system is set up in a way towards sick care, there is not appropriate reimbursement for those things that are not direct medical care that improve birth outcomes.
Sure. Let's talk, what are some of those things? Give us some
So
examples.
one of the things that we have here at NorthPoint is that we provide OB care coordination, right? So every pregnant woman who comes in gets an OB care coordinator who can help assist them and assist them with navigating the system, obtaining resources that they need. That includes if they need housing, if they need food, clothing, those things to improve their lives. There are people to help you navigate and connect you with those resources. So those pieces are not necessarily direct medical care, but they are pieces that involve social determinants of health that impact medical care. And so people who have lots of social issues are going to be at greater risk for poor birth outcomes.
Sure.
So they're directly related. And until we create a system that reimburses appropriately for that, then we always will have challenges, budgetary challenges, right, with managing care to high-risk populations, right? And so that's why some, hospitals, clinics opt out of caring for those kinds of folks. That's why we exist, right? We're a safety net clinic because we provide care regardless of people's ability to pay. But this is a social issue, and we all should be responsible for that. That means our entire community, nation, all hospitals, clinics should bear the burden of caring for those who are less fortunate.
Right. So we talk about, we talk about what we have here at at NorthPoint in terms of resources. What if, you're outside of that? You don't have a safety net healthcare access. Where can women, our Black and brown women, go to find those type of resources? Within
our community, there's a lot of resources that are culturally specific resources, let's say. We have African American Babies Coalition that works with families. We have a number of, and now of course I'm having an adult moment when I can't think of some of those things. We have the Chocolate Milk Club that supports Black breastfeeding families. We have a number of culturally specific prenatal services that are available for women in the community. And those services were developed to be culturally specific because of what we found through the research is that people have better outcomes when they see people who look like them. And so that's another issue for when you talk about systemic issues is having access to people who look like you in those positions. And I'm not just talking about supportive positions in terms of community health workers or doulas, but we're talking about people who can sit at the same table with your physician. So we're talking about midwifery care. We can't talk about improving Black birth and maternal outcomes and talk about improving the access to Black midwives, because that's an important part of the solution. And I really believe that breastfeeding is a underutilized solution to impact maternal disparities, and midwifery, Black midwives, is another key component. There's a lot of great focus on doulas because doulas have an important role to play as a part of the healthcare team, but that is almost being utilized to overlook the need for Black midwives.
Interesting.
And so we have to be careful about that because we've been pushed out of our profession in the past. And we don't want to make the same mistake again when we already are not near capacity for the amount of Black midwives that we need around the nation in period.
I want to go back to something that you are very passionate about, and that is the underutilized health solutions, and you specifically brought up breastfeeding. I just want to spend a second on that.
Well, breastfeeding is an underutilized resource. I say that over and over again because when we talk about maternal health and impacting or improving those outcomes, that initially has not been part of the discussion. And I'm always bringing that into the discussion because of the benefits of breastfeeding are so amazing. And it touches every social, economic issue that we're talking about. So it is a tool that is free, that a woman makes from her own body, that allows her infant to have better health, not just as an infant, but as an adult. It saves money. It saves time off work for having less sick children. It protects the mother's health. So it pays forward too, because it's going to also not just protect that infant's health, but as an adult, especially for African Americans, it's going to decrease the risk of high blood pressure, heart disease, diabetes, and obesity, right? Those are things that impact us at higher rates. And it's also going to protect the breastfeeding mother from female cancers, breast, uterine, ovarian cancer. It's also a great mitigator for some of the things that we see around mental health. So it's going to help with postpartum depression, right? It's a mitigator. It's not going to take someone away, but it can help mitigate that postpartum depression. So there's so many things that it does that is so important. How it heals the neural system, right? We know that infants are born and it's stressful to them to be born, and we want to intervene in that stressful intrauterine to extrauterine transition so that we decrease those cortisol levels, because we know that cortisol levels increase inflammation that lead to poor health. And so as we're understanding that in adults now, we're understanding that starts at birth. It also, so breastfeeding helps to prevent that. So it protects their health.
Okay.
We know that those who don't, overall, at birth, their health is being set up to not be as good as it could be when they're not breastfed, right? We know that breastfed infants have secured attachment. That's that bonding piece. So breastfeeding is not just about nourishment, it's also about nurturing. So those children are securely bonded. Securely bonded children have a greater emotional intelligence. They're more sociable. They're less aggressive. They're easier to parent. And so you're also meeting their needs at an age appropriate time, so that you're not trying to meet those needs in unhealthy ways later. So all of those factors, and I could go on and on.
Who knew?
Yeah.
I had no idea when they say, I'm a mom and I breastfed my daughter, but, from a very different perspective, I was not told about specific things to what's impacting me with health, with the high blood pressure and diabetes and things like that. So, all right, I do want to ask you, you mentioned women of color, black and brown women, coming and saying that they don't feel listened to, they don't feel heard. How can we advocate for ourselves in those spaces where we're feeling like that? What can we do?
I think it's really hard sometimes for women when they don't feel comfortable with their provider to speak up. I can tell black women specifically that when we come in a certain way, in a certain attitude to begin with, that non-white providers may shut down. I shouldn't say non-white providers. I meant to say white providers may shut down. So it's just important to come in speak your truth in a way that people can hear you. Okay. So that means don't, start hollering, shouting, using language that's not as healthy. But to come in and explain, I don't know what's going on. I really don't feel, I need you to really understand. And I think, again, people don't always, there's this power differential, I think, for people. They don't always feel as comfortable. They don't always feel as heard, and they often feel judged. I think it's important for us to come to our appointments in a certain manner that prevents us from being judged. That, I know marijuana is legal, but coming smelling like weed, I don't think that's appropriate to come to an appointment like that. Because that impacts. People really do treat people how they show up. And that may sound to people really judgy, but that happens. That's
That's a
just
reality.
Thank
That's
you.
a reality.
It's just a reality.
Yeah.
So you need to be mindful
Right.
of how you present yourself when you go. Always, if you can, write down if you have some concerns. You know, write them down. If you don't feel comfortable, stating them clearly, because there is that power differential for people. Hand them your list.
Okay.
This is what I'm concerned about.
Sure.
And just give them their list. Having good support, especially pregnant women. One thing about doulas' role is rather to support women in childbirth. And so they're not just to show up for the birth. Full circle, culturally specific doula service. Okay, there's a lot of people who provide doula care, but in that name in itself is really not culturally appropriate for Black people. But they use that term to talk about someone who supports another woman in birth. But the point is, a true cultural model is that they just don't show up to see you right before you deliver and they help you with your delivery.
They walk the journey.
They're supposed to walk the journey with you, and they're supposed to stay with you for that first postpartum year.
Okay.
That's
Wow.
true birth support
Yeah.
in the cultural
The
model.
whole year. Wow.
In the whole year. Yep. And so we're seeing more and more issues rise up postpartum. These people who perform this role of being a doula have such an important role in the healthcare team, because they have the opportunity to spend much more time than we do in a clinical environment, where our appointment time is very limited. They can see people in their environment at home, and they should be staying with them after birth and for a longer period of time. So they have a lot more time to influence, to help shape. You know, it's easy to talk about nutrition. You can really, when you can go in someone's kitchen with them and walk them through it, right?
Yeah.
It's like, okay, what do you have in here? Let's talk. What did you have for supper? What did and then you can have some realness here. Let's read this label together.
What an amazing resource, because, there are so many people. I think back to 24 years ago, when I had my daughter. And, I was fortunate enough, of course, I didn't have a professional doula, but, I had grandmas, and I had my mother who came in and gave advice about, who stayed with me. My mom moved in with me afterwards. What an amazing resource that we have now,
right,
for our women to take advantage of. And I think more people need to be aware of that.
Right, because we've moved away from our traditional, the way we lived traditionally, right, as Black women, right? We used to do a lot of intergenerational living, right? You lived with your mother and your grandmother, but because we've kind of brought into this pull yourself up by bootstraps mentality that doesn't exist. For us, we're tribal people. We need to live in community. We do better in community. We're healthier in community. There's so many women, trying to do life alone. That doesn't work. Right. Life doesn't work alone. Life is hard. I don't care who you are. You may think so-and-so has it all because they have things. Things are just that. Things come and go. But true health, true joy does not stem from things, okay? And so our value system has shifted, and I think that has impacted our Black maternal health outcome. And our spiritual practices have shifted. So those things impact our Black maternal health outcome, okay? And in doing that and buying into that bootstrap, we moved out of community, and moved and believed that it's quote unquote poor folks living, right? To live with your mama and your grandma. Where else should you be living if you need help and support?
That support. Exactly.
Right?
Exactly.
And we also found didn't realize how much wealth building that is, right? All that money stays in that household. Not everybody's not paying $1,800 a month.
Right. Yep.
And then that is wealth building. Then we can send a kid to college, or we can pay for this or that. So that's important to think about it in that way, and not just poor folk living. Because people get this mentality, and that's what happened with midwifery, right? People thought, white women go to the doctor and they go have their babies in the hospital. And they do formula. We want to do like them, because that looked like wealth, right? When you're
but that's not always for you.
When
right?
you're in poverty, but that's not always true. It doesn't always improve health, and so we found that we moved away from practices that were very healthy for us, to assimilate into practices that we thought looked better, looked glitzier, right? Shiny and healthy and more wealthy, and that is not the case.
Wow, you just broke that way down right there. That's it right there. Wow. Okay. Well, I think we have. Is there anything else that you want to share with our listeners today? I think we've touched on a lot of our questions here.
I just want people to understand that, one, good health begins with breastfeeding. That midwifery care is an important part of women's care in general, and to think about utilizing midwifery for your health care, and to understand that midwifery and breastfeeding really are public health solutions. They really can impact our outcomes.
Wonderful. Well, thank you for all the research you've done. As you said, you've dedicated your life work to this very important topic, and we just want to thank you for, partnering to create a healthier community.
Well,
so
thank
you for being here. All right.
Thanks for having me.
Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.
When you walk through the doors, we're here with open arms. We know that times get hard, and we're here to help at NorthPoint.
Are you finding that is a profession that folks don't know about, are not encouraged to go into?
Yes, there's different routes to midwifery, and myself, I'm a certified nurse midwife, so I'm a nurse by background, and then continue my education in midwifery, and I have a master's degree in midwifery. And there's different routes. You can be a certified midwife or a certified professional midwife or a certified nurse midwife. And so there's different tracks in that system, and those CEMs, CPMs come out of the traditional midwifery model of apprenticeship. But the CMs do take a board certified exam, very, very much like CNMs take a board certified exam as well. But even traditional midwives do take an exam as well, and they're trained, apprenticed. And majority of them work in the area of home birth, and we need them. Women need to have options. That's another thing you talk about systemic racism. Removing options for women is a systemic racism issue to me, because we need to have access to all care. All Black women are not high risk. Just because you're Black does not make you high risk. There's other factors that contribute to that. And we need to have options for care. That means options for in-hospital birth. There's a lot of sicker women that would love to have midwifery care and can have it because we have CNMs. So we need CNMs.
Sure.
But we also need the option of women who want to have birth at home, or women who want to have birth in a birth center, such as Roots, which is a culturally specific birth center in the community, or other locations that offer out-of-hospital birth options. And that is growing, and I hope more will continue to grow in terms of option. But when you talk about systemic racism again, and systemic problems that contribute, reimbursement is one of those that continue to prevail. Midwives are cheaper, but that doesn't mean you get to give us less because we're cheaper and have better outcomes. We're good for the system because our outcomes are better, but we should be reimbursed appropriately, right? And so that should mean whether you have a birth at home or a hospital.
Okay, and that's getting into legislation, right? Are there some other recommendations besides reimbursement that, from a legislative perspective, things that we should be aware of, things that we want our officials to be raising awareness around and taking that to the Hill and advocating?
There's some bills on the Hill now about medical homes or birth homes, maternal homes, that need to be supported, about licensure in the state for CMs that need support. And then we also need to think about, you know, so many times with modern technology, we're always looking at what's the new greatest, brightest, biggest thing. But we need to not forget those things that work. So one of the things that work is traditional public health model, right? You know, so home visits. I understand there are some programs that are beginning, I believe even Hennepin midwives are beginning to look at postpartum visits at home or having a mobile unit. But home visits in the traditional midwifery model would be reimbursed, right? And would be something that is a part of your care. So I think looking at some of the things that worked, public health model in terms of home visits is an important piece of that discussion. Bringing back some of those things that we know work, where people work in their community, and they live in their community, right? You know, people say, oh, do you live? No, I live in my community. I was born and raised in this community, and I continue to be in this community. I've worked and given my life around this work for my community. And I was raised by a woman who worked and lived in this community and was an advocate and an activist who gave her life for that community. So, of course, this is the model I follow. My mother's, you know, as we say, this is Mother's Day. I want to say Happy Mother's Day to my mom, Elizabeth Moore, because it's because of her that I am here doing this work, because she set the model for me. And so I think it's important to just remember some of these older things did work, and we need to bring those back, just like we need to bring back vocational education, right? We need to train people how to do plumbing, carpentry, electrician work, right? All those jobs are sitting here with nobody to take them over because no one's trained, because everyone thinks only everybody has to go to college, and that college is important for those who are able to do that. And that is, but there's also a role for vocational education. And so all of these things are important, that are older kinds of models that helped improve and moved people out of poverty and improve their health. We need to look at some of those things and reclaim what worked. All right, and then throw away what didn't, but don't throw away the baby with the bathwater.
Sure, absolutely. Wow, very insightful. Well, I have a couple more things I want to touch on. I learned something very interesting recently, and that is how blood and blood donation impacts maternal health, because we know that women who find themselves in crisis when they're going through childbirth, one of the things that comes into play is not having access, right, to blood. Can you talk about that a little bit? I think that's pretty fascinating.
Well, worldwide, the #1 cause of death for women in childbirth is postpartum hemorrhage. Okay, but the #1 cause of death for Black women in childbirth is preeclampsia. Okay, so postpartum hemorrhage is excessive blood loss, okay, in childbirth. And so having access to that blood is really important, because it can save a life, right? So that's the connection, is postpartum hemorrhage and needing blood.
And can you explain preeclampsia?
Preeclampsia is one's high blood pressure in pregnancy that can lead to seizures and death for mom and infant. And that's that connection we were talking about, high blood pressure. So preeclampsia can be something that occurs that for a woman who's never had a history of high blood pressure before, she can become, her blood pressure can go up extremely high in pregnancy. And also we watch women who already have pre-existing high blood pressure, that their blood pressure does not become uncontrolled because of that factor, as well as we get worried about fetal growth when they have elevated blood pressure, that they're not getting adequate blood supply and growth for that fetus. So,
very important.